Hello everybody, this is Carlos. Today we're going to go over removal or discontinuation of the IV cannula.
All right, so think about also, so we talked about infection, discharge, phlebitis, medication infiltration, extravasation, right? Medication that doesn't go into the vein but starts burning the patient, redness on the, if you have any redness at the site, right? Any pain, or if the doctor orders DCIV, right? The patient says DC saline lock or discontinue saline lock, then you're gonna discontinue that. But very good. So those are some of the cases that we are going to do with that. So how do you discontinue the saline lock? First and foremost, we're gonna do our 3 foundation things, bread and butter things of nursing, which are hand hygiene. Mr. Smith, my name is Carlos. I'm a practical nursing student. I'm here to remove your saline lock. I see that's inflamed, and we got an order from the doctor to remove. Is that okay with you? Yes. Okay. And the last thing, privacy, right? Because nobody else needs to know what we're doing, because just for privacy reasons, right? Very good. If I'm interacting with a patient, and since I am actually removing saline lock, there will be chances of bleeding, correct? And let's gather some of our supplies. Okay, so you're gonna need some gloves. You're gonna need some of the gauze, which, oh, perfect. I still have some gauze, right? So I have some gauze in here. And last but not least, you need some tape, because we love to tape everything, right? All right, so hand hygiene. Now, and this is the process that we're gonna take. Okay, you're gonna explain the procedure to the patient as we did. Mr. Smith, we're gonna remove it. Your saline lock because it looks swollen. You're complaining of some pain, and we also got a doctor's order to remove it. Okay, so he's okay. All right. So as you can see from the screens over there, okay, one of the things I want you to become familiar with, and the blue pads, they're like godsend, okay, because you can use, they absorb so much, and they will prevent you from getting a mess all over, especially when it comes to anything that involves bodily fluids, blood, emesis, you name it, right? So Mr. Smith, can I just put a blue pad under? Now, if there's bleeding, it bleeds onto here, right? And not on the patient's bed, because this in clinical will be your patient's bed. You agree? Right? All right. So next, what we're gonna do is we're gonna inspect the site. So, oops. As you can see, from here, you can see that the site is, I'm just using as an example. Mr. Smith, I see that your site is a little red on inspection, and this is where we're gonna review some of our health assessment stuff, right? On inspection, I can see that your skin's a little red, it looks swollen. There's certain areas here that appear more discolored than the other, and you are stating that you're having some pain, okay? Inspection. Palpation, remember our IPPA, right? Palpation. So I see that your arms are a little bit warm, and it looks swollen. And when I palpate and when I touch, does it hurt? Yes, it does hurt. Okay, so we kind of have an idea that it's probably the IV is either swollen, that the site needs to be reassessed, right? And also that there might be an infection. Okay, some of the things that we might want to check. All right, so before we start, always you're going to get all your supplies ready. And as this, everything you're gonna open as a banana. Another thing that you learn anything from today, you're gonna open everything like a banana, and there's always things to open packages, okay? So don't just tear them apart. All right. So next, what you're gonna do is we are going to start removing some of the tape. So I wanna see if you can do it like this, maybe right here, okay? All right. So first, we're going to start by removing some of the tape. Okay, now, if you have a patient who has a lot of arm or like a hair in their arm and stuff like that, just let them know that, it's going to be a bit uncomfortable. Okay. You never tell patients, oh, it's going to be okay, because we know it's not, right? So we're going to tell them you might feel a little uncomfortable, especially when we pull out the tape. We're going to try to do it swift so that it minimizes it. So, and when you pull out the tape, team, too fast, no good, because it becomes almost like a wax. Too slow, you're kind of like prolonging the suffering in a way. Can you imagine just kind of like this? No, so do it steady, in a steady but swift way. Okay, so we got that. Okay, so remove that part there, and next, what we're gonna do is you're gonna put your finger on. Okay, as you can see, as I remove it, I have a finger to hold it in. You see how I'm actually pulling on the tape on the side, like here, pulling on the side, but holding it, right? Now the other side, pulling on the side, holding it. And do you see that I'm actually pulling the tape towards the heart, right? Towards the heart, that way, not this way, because if we do it this way, do you think this will pop up? So that's a rationale, towards the heart, okay? Towards the heart. And you see how my fingers always kind of cover here, all right? So we have that part there. After this is done there, this is where we're gonna grab some of our gauze, okay? So Mr. Smith, I'm just gonna remove it in one swift pull, and you're gonna let me know if there's any discomfort, okay? So you're gonna put some pressure in there, and then you're just gonna pull steady and swift, same thing, okay? And it's gonna go like this. So 1, 2, 3. Now, once you pull it out, you have to do a few things. Once you pull it out, you make sure that this finger is putting pressure so it doesn't bleed. Number 2, we're gonna look at the IV. Does it look intact? Right? So it looks intact. We always check for the tip. Is the tip intact? Is it damaged like this? Oh, imagine if we pull out the IV and it comes out like this. That's a problem. That means that the whole cannula is inside, right? So, but in this case, it's not, right? So we check, yes, the tip is in there. Now, if the tip or part of the cannula is missing, what do we do, team? What do we do? Okay, that's part 2. But as a nursing intervention, what would you do? Okay, apply the tourniquet. Yes, someone said a tourniquet. So maybe you can pass in the tourniquet. Now, why are we going to apply the tourniquet? Yes, very good. 1, to prevent it from going to the heart, because remember, isn't the heart this way, right? So what we're gonna do again, so let's say that when we pull out the IV, that part of it was missing. Okay, so we're gonna put again about 10 centimeters above our insertion site. Okay, insertion site. Now, the tourniquet in this case is gonna serve 2 purposes. First purpose is gonna prevent it from further migrating into the heart, preventing things in the vein from getting further into the heart. Hence, we're creating a blockage. As the veins, we say that the veins have valves. What is the veins gonna do at this point if we are having the tourniquet up there? The site is here. Do you think it's gonna bleed? Yeah, because the veins are dilating. Everything is backing up here, right? Backing up to here, it cannot go further. So instead of going this way, your veins are going to go this way. Gonna dilate. As you start to dilate more, you should start to bleed more. So first thing you're gonna do is you put a tourniquet. Number 2, you're gonna try to palpate. If you feel the piece of the cannula in there, you try to bring it out to the insertion site to see if it can come out. Because now that the veins are dilated bigger, the hole where, in the vein is supposed to be bigger. So hopefully that little piece can squeeze out of there. If this intervention does not work, tourniquet and massaging it to kind of get the piece out, then we let the doctor know. We tried this, we put a tourniquet, we try to massage it, but I can still feel the piece there. So then this might need further intervention, as in might need to have a maybe like a surgical intervention to kind of get it out. Does that make sense? Okay. So let's say that part, but that's something that you would do. Once you remove the IV, you will always tell me, I'm going to check, make sure the catheter is intact. There is no bacteria or there's no pus or anything growing in it, because it tells you a lot, right? If you pull out the IV and it's full of pus, the site is really, really swollen and infected, right? So it tells you a lot. So then after that, we're going to remove, applying pressure, and we are just going to put a little tape. Now, what would we put in our discharge, in our IV discharge documentation? And then this goes in the sharps container. So in this case situation, patient's IV in the right arm, specifically forearm or dorsal part, antecubital, right? Because you've been very specific about where the site is. In this case, it's going to be in the forearm. So patient's IV in the left forearm appears swollen, red. Patient was complaining of pain, right? On inspection, the site appear red, and patient was complaining of discomfort. Doctor was notified and was recommended to remove the IV and resite it, or remove the IV and reassess, whatever is it, right? And then after that, you can just put your signature in there and initials.
My documentation will be as follows. IV saline lock removed from left forearm. Patient was stating that site felt sore and uncomfortable. On inspection, the site appeared red and swollen. On palpation, the site was hot and tender to touch. IV cannula was removed without complications in one attempt. Upon removal, the tip of the cannula was intact and fully visible. Direct pressure was applied to site and no further bleeding was observed after 5 minutes. Patient was calm and cooperative throughout the procedure. Call bell is within reach and patient knows to call for help if the site starts to bleed. Sign. Please keep practicing and thank you for watching.